Among President Biden's new executive orders is directing the Defense Production Act to ramp up the supply of N95 masks for healthcare workers. But we might need as many as we can get for the rest of us, too. European countries are strengthening their mask rules. So the question is, will the U.S. follow? NBC Barry's Cheryl Hurd looks at the changes we could soon see.
In the beginning of the pandemic, N95 masks were in high demand, people even being told not to buy them, as they should be reserved for frontline healthcare workers.
They are actually the best mask you can get in terms of blocking the most amount of virus.
UCSF infectious disease Dr. Monica GANDHI says the problem with the N95 is they are still in short supply. President Biden's signing of the Defense Production Act will help bring in more for frontline healthcare workers. But for everyday people, mask wearing is evolving. People are starting to double mask. The trend is to wear a single mask and put a cloth mask on top of it. Healthcare workers have been doing it for a while. Double masking was seen at this week's inauguration. Dr. GANDHI says it's not a bad idea.
Older people who are very vulnerable, especially indoors, if you have to work in crowded indoor conditions, and if you happen to be in an area where there's a lot of transmissibility going on.
But when it comes to wearing two masks in the U.S., doctors don't always agree on its effectiveness.
The air sort of rushes around the areas around your nose and your mouth, so it actually almost in a way bypasses the effect of actually having a filter. So I think for that reason, I would actually encourage people to not double mask.
I wouldn't be doing it for going to the grocery store or something, but if you're going to be intensely exposed, like on a flight, I think it probably makes more sense. But make sure you wear glasses too.
And as N95 production ramps up, it remains to be seen if and when they'll be available to everyone. Cheryl Hurd, NBC Bay Area News.